Mr. President, my grandma taught me so many things and had so many great old sayings. One of the things she taught me is that if you have your health, you have everything. If you have your health, you have everything. I think that's one of the reasons I wanted to become a doctor. I wanted to help give people their health. But Mr. President, healthcare is in a crisis right now. Healthcare is in a crisis. Doctors think healthcare is in a crisis. Nurses think healthcare is in a crisis. Patients, families, Americans, we all think that healthcare is in a crisis. And the Democrat solution is frankly just to throw more money at the problem. Throw more money at the problem, which really inflates everybody else's cost of healthcare. What our party would like to do is to empower patients, not insurance companies. We want to put patients in charge, not insurance companies. And before we, dive down a little deeper into our bill that we're asking unanimous consent for today, I want to answer, I think, one of the toughest questions I've been asked. And the question is, when I go back home in January, families are going to look to me and say, why couldn't you fix health care? And I want the record to show right now that the Democrats are walking away from a year-long extension on the enhanced subsidies. They're walking away. We're offering it. I don't think the subsidies are a good idea. I never did. But my heart says it's the right thing to do. So let the record show, if the Democrats object to this bill, they're walking away from a year-long extension of Obamacare in exchange for empowering patients. This crisis, I think we need to understand a little bit more where this crisis came from. Obamacare has been the law of the land now for 15 years, and perhaps Speaker Pelosi's most famous moment of her career is when she said, we need to pass the bill so we can see what's in it. Well, now we know what's in it. We know it was written by insurance companies. We're giving them $150 billion a year. It was written by PBMs. It was written by big hospital systems, big healthcare systems who've driven the spend on healthcare for this country now to $5 trillion a year. And what we've ended up with, of course, the costs are higher. No one can deny that the average premiums are now more than 200% higher than they were. Access is worse. Fraud is rampant. And really, Obamacare is junk insurance, right? When they talked about what junk insurance was when they argued for Obamacare, Obamacare has turned into junk insurance. When families have a deductible of $15,000 a year, that's junk insurance, right? So we ended up doing just the opposite of what they stated their intended goals were. So listen to what the Democrats are saying now and then what they're willing to do. Let me just sum up briefly what our plan does, and then I'll maybe go a little bit deeper. Number one is we address the fraud. Number two, we extend the Obamacare, the Biden era extended subsidies for another year. We fund CSRs. We address fraud, if I didn't say that yet. And then starting in 2027, we would start taking some of that money that we were using on these extended subsidies. That's about $35 billion a year. We would start putting that into your debit card, into your healthcare debit card. Thousands of dollars per family. For some it might be $7,000, for some it might be $5,000, but we want you to start making choices. And then lastly, what our bill does, and this is really why I'm so confused why Democrats would walk away from this. If there was one good thing about Obamacare, it was addressing pre-existing conditions, and we'll talk about that more in a second. But our bill funds invisible, high-risk reinsurance pools. So it's like belts and suspenders for people that develop high-risk conditions. So let's dive into each one of these pillars. a little bit more. Number one is let's stop the fraud. No one can deny that there's significant fraud in Obamacare. We don't know exactly how much. Is it $20 billion? Is it $30 billion? We know that a third of people on Obamacare never make a claim. A third of people on Obamacare never make a claim. And we know that we saw the fraud increase significantly when we allowed people to have $0 in the game. So what our bill does is, number one, it requires an ID verification. It requires work verification. It requires income verification. And then it requires you to contribute $5 a month. If these were implemented, I really think we would save the country $25 billion a year. And again, that would more than fund this high-risk pool that I'd like to do. I think stopping the fraud, there couldn't be anything more simple. But even just yesterday, the Democrats refused, and they voted down addressing the fraud. Next, our pillar is real price transparency. If we adopted this, the cost of health care for everyone, whether you're on Obamacare or you get your money through your work or you're on Medicare, it would drive down the cost of health care by everybody by 20%. Rather than spending $5 trillion a year, this country would be spending $4 trillion a year. Think of the great things else we could do if we had that money to do better things with it. We could fund community health centers. So many great things we could do out there from a healthcare standpoint as well. But by giving price tags to patients, by forcing every healthcare provider up front to have a list of everything that they offer, and have that already on a website ran by CMS, and you're sitting there in your hometown and the doctor says you need to have your knee replaced, and you could automatically have populated within 60 miles all the hospital's charges. And you're going to find some hospitals charge $10,000 for that hip replacement, others charge $60,000 for it. Some $120,000 for it. Heck, you might even hop on a plane and fly from New York City to Kansas to save $120,000 on a hip replacement, and we'll put you up in the best hotel in all of Kansas to do that. But price tags is what cures that. Price tags turns patients into consumers. It lets patients become shoppers again. Boy, over and over again on Black Friday, Americans demonstrate to me that they have strong purchasing power and they know what they're wanting to do with those dollars. So by empowering patients, by turning them into shoppers again, by forcing price tags, this is going to lower the cost of health care for everybody by 20%. Our third pillar is to bridge subsidies for families. Look, you don't have to convince me the cliff people are facing. Because of Obamacare, premiums are going to go up 20 to 30%, regardless of what we do here in Congress. Premiums are going to go up 30%. And I want to help those people. It may be, the people most impacted by this cliff, there's probably 1 million of them. Maybe there's 2 million of them as well. And that's why we need to do more than this bill, is to impact them long term by allowing them to purchase health care across state lines and expand association health care plans. But again, we're extending the subsidies for 1 year. No other deal up here is really on the Republican side addresses that except for this particular deal. I know my friends want 3 years. Look, let's talk about it. What would it take for you to actually consider driving the true cost of health care down and not just throwing money at the problem? And I just can't emphasize enough. You're a family of 4, you're making $80,000 a year, which is more than the average salary in Kansas, and you have a $15,000 deductible. That's not access to health care. You have to admit, and I think my Democrats do admit, that Obamacare is broken. Next, I want to just talk about our invisible, state-ran, high-risk pools. Look, I talked a second about pre-existing conditions. The one thing I was really excited about Obamacare was that it took care of the pre-existing conditions. Guess what the most common pre-existing condition is in America? It's pregnancy. Mr. President, I delivered a baby almost every day of my life for 25 years, and believe it or not, less than half of pregnancies are planned. And when couples were purchasing, they get married, they purchase health insurance, and they were going to save a couple $100 by not including pregnancy. They thought it was a good idea, but guess what? Mother Nature doesn't always cooperate. And again, half of these pregnancies were not planned. So I was glad to see us address pre-existing conditions. But even now we know insurance companies do play games to try to keep you out once you have a tough diagnosis. But if those insurance companies knew that, based upon your diagnosis and the money you're spending, you're already going to this partially federally funded high-risk pool, that it would keep everyone's premiums down. And my friends across the aisle talk about, they tug at people's hearts, which I want to do as well. We don't want anyone to face bankruptcy because of healthcare, but that's happening now, right? Admit it, your plan's not working. All these many families are facing and have taken bankruptcy because of the cost of health care. So we use this belt and suspenders approach. We have the pre-existing conditions in Obamacare, we keep those, but then we do something better by funding these high-risk pools as well. High-risk pools let us protect the sick without punishing the healthy. If these catastrophic costs are covered, premiums fall for everyone. That's just simple common sense. If you think about these 5 pillars here that I want the Democrats to agree with, I bet we drive down the cost of health care by 40 to 50%. Our last pillar is just this theme of turning patients into consumers by giving them price tags, by putting federal dollars in your debit account for health care, by giving you price tags. We turn you into shoppers again. It's going to lower the cost for everybody. And then we start reallocating that waste from fraud and abuse. What makes our plan different than anybody else's out there? We address the fraud. We have price tags that no other plan has. It bridges the subsidies. And instead, my Democrats are offering a $83 billion fix. The Democrats are just compounding the junk insurance, with all due respect to my friends across the aisle. You're just throwing good money after bad money. By extending these subsidies for 3 years, it'll be at least $83 billion. And the way healthcare is accelerating, it'll be $100 billion. Again, I do feel the pain of these folks. I mean, these are my friends, my neighbors. A top 3 issue for every family in America, for every business in America, is the cost of health care. How can you walk away from a plan that's going to drive the cost of health care down 40 to 50%? And instead, you just want to offer more junk insurance. Your plan doesn't do anything to bring down the cost of the deductibles in the plan. That's the problem. You could pay for their whole premium. We are paying for their whole premium, but then they have a $15,000 deductible. That's not access to health care. I don't know why my friends across the aisle don't want to have meaningful discussions. Why do you not want to talk about fixing the problem? There's so much more than this that we should be talking about right now. Again, pharmacy benefit manager reform comes to mind. Expanding community health centers, making sure everybody has meaningful access to primary care, bringing mental health into those community health centers. Those are all real solutions. Expanding association healthcare plans, letting it be purchased across state lines. Could you imagine if Sam's Club or Costco or Amazon had an association health plan that you could sign up for? Think of the purchase power that they would have. Mr. President, there's real solutions out there. These are real solutions. Democrats have asked for a plan. This is frankly just the start of a good plan, but it would help bridge us over the next year to go after these other issues we can address on a bipartisan basis. And remember, I'll just close with this, Mr. President. When patients ask their senators in January why their health insurance premiums went up, and they're going to ask you, why did you vote against Senator Marshall's plan that extended the subsidies for a year? I hope you've got a great answer for that. Thank you, Mr. President. I yield back. I ask unanimous consent that the Finance Committee be discharged from further consideration of Senate 3389 and the Senate proceed to its immediate consideration. I further ask that the bill be considered read a third time and passed, and that the motion to reconsider be considered, made, and laid upon the table.
Reserving the right to object.
Senator from Delaware.
Mr. President, I had the honor of serving with Senator Marshall in the House. We were classmates. We came in together in 2016. It's kind of ironic to think back to that time because as a freshman, I watched my colleagues try to repeal and replace and repeal and replace and repeal and replace. And just last week, Senator Marshall and I introduced the PBM Disclosure Act together, a bill regarding PBM transparency. We worked on some important things. But at this moment, I can think of nothing more important than addressing our nation's healthcare crisis. Unfortunately, I cannot support what's being proposed here today. Now, we all agree that our healthcare system needs improvement. The Democrats have put forward proposals to do just that. As a matter of fact, Senator Wyden, who is sitting on the floor right here today, has put forward a proposal, a bill that deals with the issue of fraud. And as he said, he'd love his Republican colleagues to join him in that effort. This bill claims to actually attack fraud and also claims to fix the premium crisis. But in reality, it would kick millions of Americans off their ACA health care coverage. Premiums would go up for over 10 million people by an average of $1,000. And to top it all off, this bill adds new abortion restrictions. It is yet another harmful proposal from Republicans while the clock is ticking for the American people. Almost a dozen proposals have been offered by Republicans in the Senate and the House in just the last few weeks. That is tantamount to throwing spaghetti up on a wall to see what sticks. For months, we've asked Republicans to come to the table. During the shutdown, they said they couldn't talk to us about health care. Yet, they were still holding hearings on a whole host of things. They spent 6 months before that, in the beginning of the year, passing tax cuts for billionaires. Apparently, that wasn't time to talk to us either. The very first bill I co-sponsored as a United States Senator back in January was the Healthcare Affordability Act, which would have permanently extended the ACA tax credits. Now it is December, almost a year later. As I already said, we've received almost a dozen plans from Republicans, and they're still coming in. As a matter of fact, I think one came in last night. Let us help you help your constituents. Democrats are offering the cleanest, easiest, simplest way to deal with the immediate healthcare crisis, the immediate healthcare cliff that Americans are facing, and give us time to improve our healthcare system. It would even give us a chance to review the thousands of plans and concepts of plans that my colleagues are putting forward. This bill is too little, too late. And for that reason, I respectfully object.
Objection is heard. Senator from Kansas.
Again, I greatly respect the words and have great respect for my senator, my colleague and good friend from Delaware. And I know both of us share the same heart, that we want every American to have meaningful access to health care. There are many things we agree upon. The PBM Disclosure Act is but one example. Bringing down the cost of prescription drugs would be a huge priority for us as well. We both agree that fraud's a problem. Take this bill and improve it. Is it too little? It probably is too little, but it's a start. It's a framework. You had the legislative text. Look, I've become very pragmatic in my days in Washington. I can't change what happened in 2010 before I got here. I can't change all the histories of dealing with health care. I can't change the fact that we have 100 senators with 100 ideas to fix Obamacare. I've always said tackling Obamacare is like tackling a buffalo that just ran through a barbed wire fence, and every time you try to pull a layer of that barbed wire off, you get poked with it. I understand that. But this is a great framework. It's my effort at a bipartisan framework to get us started. And again, offering the olive leaf of extending the Biden-era subsidies for another year, I think is just the biggest olive branch I can make. And again, come January, my Democrat friends are going to have to answer that question. Why did you walk away from Senator Marshall's plan to extend those subsidies for a year? Thank you, Mr. President. I yield back.